7 signs and symptoms of hyperthyroidism. Thyroid disorders are common. In fact, about 12% of people will experience abnormal thyroid function at some point during their lives. Women are 8 times more likely to develop a thyroid disorder than men. Also, thyroid problems increase with age and may affect adults differently than children. At the most basic level, thyroid hormone is responsible for coordinating energy, growth, and metabolism in your body. Problems can occur when this hormone's level are too high or low. Hyperthyroidism, or low levels of thyroid hormone, slow your metabolism and decreases growth or repair of many parts of your body. What is hyperthyroidism, or low thyroid? The thyroid is a small, butterfly-shaped gland that drapes across the front of your windpipe. If you place your fingers on the sides of your Adam's apple and swallow, you'll feel your thyroid gland sliding under your fingers. It releases thyroid hormone, which controls the growth and metabolism of essentially every part of your body. The pituitary, a tiny gland in the middle of your head, monitors your physiology and releases thyroid-stimulating hormone, or TSH. TSH is the signal to the thyroid gland to release thyroid hormone. Sometimes TSH levels increase, but the thyroid gland can't release more thyroid hormone in response. This is known as primary hyperthyroidism, as the problem begins at the level of the thyroid gland. Other times, TSH levels decrease and the thyroid never receives the signal to increase thyroid hormone levels. This is called secondary hyperthyroidism. Thyroidism, or low thyroid, can cause a variety of signs and symptoms. This video will help you recognize and understand these effects. Here are 7 common signs and symptoms of hyperthyroidism. Number 1. Feeling tired. One of the most common symptoms of hyperthyroidism is feeling worn out. Thyroid hormone controls energy balance and can influence whether you're feeling ready to go or ready to nap. As an extreme example, animals that hibernate experience low thyroid levels leading up to their long sleep. Thyroid hormone receives signals from the brain and coordinates cells to change their functions, depending on what else is going on in your body. Those with high levels of thyroid hormone feel anxious, nervous, and jittery. In contrast, people with low thyroid feel exhausted and sluggish. In one study, 138 adults with hyperthyroidism experienced physical exhaustion and reduced activity. They also reported low motivation and feeling mentally tired. Low thyroid individuals feel unrested even though they may be sleeping more. In another study, 50% of people with hyperthyroidism felt constantly tired, while 42% of people with low thyroid hormone said they slept more than they used to. Feeling sleepier than usual without a good explanation could be a sign of hyperthyroidism. Number 2. Gaining weight. Unexpected weight gain is another common symptom of hyperthyroidism. Not only are low thyroid individuals moving less, they're also signaling their livers, muscles, and fatty tissues to hold on to calories. When thyroid levels are low, metabolism switches modes. Instead of burning calories for growth and activity, the amount of energy you used at rest, or your basal metabolic rate, decreases. As a result, your body tends to store more calories from the diet as fat. Because of this, low thyroid hormone levels can cause weight gain, even if the number of calories eaten remains constant. In fact, in one study, people with newly diagnosed hyperthyroidism gained an average of 15 to 30 pounds in the year since their diagnosis. If you've been experiencing weight gain, first consider whether other changes in your lifestyle might explain it. If you seem to be gaining weight in spite of a good diet and an exercise plan, bring it up with your doctor. It might be a clue that something else is going on. Number 3. Hair loss. Like most cells, hair follicles are regulated by the thyroid hormone. Because hair follicles have stem cells that have a short lifespan and a rapid turnover, they are more susceptible to low thyroid levels than other tissues. Low thyroid hormones cause hair follicles to stop regenerating, resulting in hair loss. This typically improves when the thyroid issue is treated. In one study, about 25 to 30% of patients seeing a specialist for hair loss were found to have low thyroid hormone. This increased to 40% in individuals over 40. Furthermore, another study showed that hyperthyroidism may cause coarsening up of the hair in up to 10% of individuals with low thyroid hormone. Consider hyperthyroidism if you've experienced unexpected changes in the rate or pattern of your hair loss, particularly if your hair becomes patchy or coarser. Other hormone problems can also cause unexpected hair loss. Your doctor can help you sort out whether your hair loss is anything to worry about. Number 4. Feeling down or depressed. Hyperthyroidism is linked to depression. The reason for this is unclear, but it might be a mental symptom of an overall decrease in energy and health. 64% of women and 57% of men with hyperthyroidism report feeling depression. About the same percentage of men and women also experience anxiety. In one study, thyroid hormone replacement improved depressions in patients with mild thyroidism, compared to a placebo. Another study of young women with mild hyperthyroidism showed increased feelings of depression, which were also connected to decreased satisfaction with their sex lives. Furthermore, postpartum hormone fluctuations are a common cause of hyperthyroidism, potentially contributing to postpartum depression. Feeling depressed is a good reason to talk to a physician or therapist. They might be able to help you cope, regardless of whether the depression is caused by thyroid problems or something else. Number 5. Trouble concentrating or remembering. Many patients with hyperthyroidism complain of mental fogginess and trouble concentrating. The way this mental fogginess presents itself varies by person. In one study, 22% of low thyroid individuals described increased difficulty doing everyday math. 36% described thinking more slowly than usual, and 39% reported having a poorer memory. In another study of 14 men and women with untreated hyperthyroidism, the participants showed difficulty remembering verbal cues. The causes for this are not yet fully understood, but difficulties in memory improve with treatment of low thyroid hormone. Difficulties in memory or concentration can happen to everyone, but if they are sudden or severe, they could be a sign of hyperthyroidism. Number 6. Constipation. Low thyroid levels puts the brakes on your colon. According to one study, constipation affects 17% of people with low thyroid hormone compared to 10% of people with normal thyroid levels. In this study, 20% of people with hyperthyroidism said their constipation was getting worse compared to only 6% of normal thyroid individuals. While constipation is a common complaint in patients with hyperthyroidism, it's uncommon for constipation to be the only or most severe symptom. If you experience constipation but otherwise feel fine, try these natural laxatives before worrying about your thyroid. If they don't work, your constipation worsens, you go several days without passing a stool, or you begin having stomach pain or vomiting, seek medical advice. Summary: most people with constipation don't have hyperthyroidism. However, if constipation is accompanied by other signs of hyperthyroidism, your thyroid may be the cause. Number 7. Heavy or irregular periods. Both irregular and heavy menstrual bleeding are linked to hyperthyroidism. One study showed that about 40% of women with low thyroid hormone experienced increasing menstrual irregularity or heavy bleeding in the last year, compared to 26% of women with normal thyroid levels. In another study, 30% of women with hyperthyroidism had irregular and heavy periods. These women had been diagnosed with hyperthyroidism after other symptoms had caused them to get tested. Thyroid hormone interacts with other hormones that control the menstrual cycle, and abnormal levels can disrupt their signals. Also, thyroid hormone directly affects the ovaries and uterus. There are several problems besides hyperthyroidism that can cause heavy or irregular periods. If you have irregular or heavy periods that disrupt your lifestyle, consider talking with a gynecologist before worrying about your thyroid. Hyperthyroidism, or low thyroid, is a common disorder. It can cause a variety of symptoms such as fatigue, weight gain, and feeling cold. It can also result in problems with your hair, skin, muscles, memory, or mood. Importantly, none of these problems are unique to hyperthyroidism. Yet, if you are having several of these symptoms or they're new, worsening, or severe, see your doctor to decide if you need to be tested for hypothyroidism. Fortunately, hyperthyroidism is generally treatable with inexpensive medications. If your thyroid hormone levels are low, a simple treatment could greatly improve your quality of life.